Welcome back to the second episode of our medical series, Intervention for Medical Emergencies. On this episode, we're going to be talking about asthma attack. What can you do when someone around you has an asthmatic attack or asthma attack? Now, first of all, I need you to know that the most important thing that the patient needs, or anybody that has an asthma attack needs, is air or oxygen, because asthma attack happens as a result of obstruction in the airways, which leads to inadequate supply of air to the lungs. Now, what are the steps that you can take to restore back air into the lungs and allow easy flow of air in the airways? Now, the first thing that you need to do is to make the patient sit upright. Do not allow them to lie sideways, or do not allow them to bend, or don't allow them to lie down. The first major step that you need to take is to make the person sit upright. Now, what does this do? When someone is seated upright, it helps the diaphragm work efficiently. Now, once the diaphragm is working efficiently, it means that the lungs is opened properly the way it's supposed to be open. Now, once the lungs is open, this allows easy flow of air into the lungs. Remember, we were telling you that there's an obstruction in the airways, so the diaphragm working efficiently means that more air is going to come into the lungs. Now, this is crucial in any asthmatic attack in restoring the patient's health. Now, the second thing you are going to do is to get an inhaler. Now, most asthmatic patients always have an inhaler with them. So what you need to do, check the person's back, check anywhere, and check if the person has an inhaler. Now, what type of inhaler you need? Any of the better agonist inhalers, you can get salbutamol inhaler, albuterol inhaler, any inhaler that is meant for asthmatic patients. Now, what does this do? These inhalers are beta-2 agonist inhalers. They bind to beta-2 receptors in the smooth muscles of the bronchi. Now, what does it do? This allows the relaxation of the smooth muscle. So once the smooth muscles are relaxed, it helps to expand the airways, and this will actually let in more air into the airway. So this helps to remove the obstruction into the airway, because in asthmatic attack, there's a constriction of the smooth muscles in the airways. The smooth muscles are constricted. So once you bring in these inhalers, when these inhalers are taken, the inhalers actually helps to relax and expand the airways. So as a result, more air can enter into the airways. Now, there are situations whereby after giving inhalers, you notice that the patient is not responding properly, or you notice that the lips are becoming blue, or the patient is becoming drowsy, or you notice that the patient cannot complete a statement. It means that the patient actually lacks oxygen at that point. So the four major things you need to do is to get an emergency help. First, the patient to the nearest hospital and call for help immediately. But first, make sure you take the first two measures, making them to sit upright and administering a beta-2 agonist inhaler, salbutamol, albuterol. You know the common one, Ventolin inhaler is the most common inhaler, so you can get any of the asthmatic inhaler, and you are already saving life already. I remain your favorite pharmacist, Dr. Best. Thanks for watching. Make sure you share this video to any one of your friends, so that one day they can be of help to an asthmatic patient. See you in our next episode. God bless you. Love you.